Well, hello again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to cover some more Class 2 Division 2. This is case number 4, and in this case, for some reason, we took the upper 6-year molars out to rotate, and he was missing something on the bottom to get it to balance out like that, and it worked out quite good. Now, the older person looks different from the younger person, but they are the same people. So let's get on with the case here and try to show it as quick as we can. Looks like he needs a little extra draw area out here in the front. And so that may have been one of the reasons we took the upper molar out. And this is the Class 2, Division 2, and the teeth are kind of tucked in, and he's got a rotated bicuspid. I'll show that to you. And these teeth close up the lower teeth again, and this is all closed in this way. Of course, when you've got a bite like that, you can't do anything but chew this way. You can't move your jaw from side to side. These teeth hit over here, so you chew straight up and down, and your chewing becomes far better, about 4 times better, people that do research in here say. And so we try to raise this up, and in this particular case we extracted some teeth, but that is not normally what we would do in a Class 2 Division 2, but something's missing down on the bottom. So we're going to raise this up and bring these back, the whole thing back, and bring this out again, and we'll close this space where we make taking this tooth out on the dump. Okay, this is 83. And we're going to put this tooth in this gap, or we're going to move this out and make this back some, and this tooth will go down in that gap like that. We'll pull this in and finish and then we use the wisdom tooth above. So here we are at this point. He's got a badly rotated tooth. We're going to turn it around and put the buccal part of it out here, and we'll take this back some and this forward some and close that up, and that'll bring the jaw back over the lower jaw to some extent. Okay, now we'll go in here, and the lower jaw is pretty well shaped, and when we open that up, we can have room for these teeth to fit right there. This is 1983, and here is age 19 and 8. He's just about 20 years old here. We've just about brought these teeth together. You see this, it's closed up over here, and over here the same way it has brought together, and that brought the upper teeth back, and the lower teeth are fitting right underneath them. We'll show that a little better later on down the line, and we bring that, close that gap together. You can see we got some arrows in there, but there was teeth missing on the bottom, and so we got to match that up. We could have done it without it, but that's the way we did that case. So here we've got this deal, we hook the elastic here, go all the way around that tooth, and hook it over here, and that spins that tooth in this direction. So it's a good example of rotating the teeth in here. Now we've got our bias and the cuspids and everything else lined up going around here, and we'll bring this back and pull this back some to bring it back with the lower teeth. And that rotation is a excellent way. It's the best way I know of rotating a tooth. You can get in here and attach that. We've got a video or two on that, and you wrap it around the tooth, and you come back and hook it on the bracket, and that tooth will just spin like that. And sometimes you have to put acrylic bump in here to keep that elastic chain from slipping over the top of it, and it'll close around and just spin that tooth around like that. And that's an excellent picture of showing you how to rotate teeth. That's the best way. It's a low rotator teeth that I've ever seen, and it'll rotate during anything you can put it on like that. Now we've opened the bite, and we've got the teeth up there. This is 1987, and we started 83, 4, 5, 6, and 7. So we spent a little longer working on this young man to get him to this point. But here he is at this point. We've finished up, and we've got the cuspid tooth coming down in this groove. If you look at it from the side, it's right over that deal, like that. Now, if he wears this, we'll put a retainer on him, and you see this whole arch is going to be changed by bringing this forward. But here it is with these teeth out, and we brought this forward like that, close the gaps up. Now you see these. This is on the bottom with the wisdom teeth, and here are the second molars, and the wisdom teeth are back in this area. And this is 1983. And here the young man is. This brought the facial structure back in the top part up here. Rather than try to bring the jaw out further, we brought the top back in some. Now this changed the appearance of the man, but he's got the chin right underneath there like that. And there's his smile. He looks quite different as he got older with that portion brought back in like that. And there he is again. That facial structure is lined up good. And we'll just close out here, and I'll say thank you for watching, and we hope you'll subscribe to our channel, and we'll look forward to seeing you again in other cases. Thanks now, and I'll say goodbye.